Welcome to the deep dive. Today, we're tackling something really, really important for anyone with a pet. It's a serious, life-threatening emergency urinary tract obstruction in dogs and cats. We've been digging into the clinical guidance on this one.
Yeah, and our goal today is to unpack all that essential info for you.
Yeah.
What is actually happening when a pet just can't urinate? Why is it so dangerous so fast? And, critically, what needs to be done right away?
Exactly. This is really your essential guide to understanding this urgent situation. And honestly, getting a handle on this isn't just, academic. It could genuinely help you spot those early signs, maybe even save a pet's life.
It's definitely one of those things where knowing what to look for makes a huge, huge difference.
Okay, so let's get into it. Picture this. Maybe your own pet, or one you know. A male cat, say Fluffy, or maybe a dog like Buster. Suddenly they're acting weird around the litter box or when you take them out. They're trying, maybe straining really hard, but nothing or almost nothing is coming out. What's going on there?
Well, that's the really scary possibility of a urinary obstruction. Fundamentally, it's just a blockage stopping urine from leaving the body normally. Think of it like a really bad plumbing backup. Could be anywhere along the line: kidneys, the tubes called ureters, the bladders, or actually most commonly the final tube, the urethra.
Right, and you often hear it's a massive emergency, especially for male pets. Why males in particular?
Yeah, their anatomy is key. The urethra, that exit tube, it's just much longer and narrower in males compared to females, so it's way more likely to get completely blocked. Normally, kidneys make urine, it flows down the ureter, stores in the bladder, then out the urethra. Easy. An obstruction just puts a full stop on that whole process.
Okay, so a blocked tube. Simple enough concept. But why does that simple plumbing issue turn into such a major crisis so incredibly quickly? This is where the biology gets, well, pretty intense.
Uh-huh. That blockage sets off this whole cascade of really bad events. Urine can't get out, right? So pressure builds up all the way back up the system, right to the kidneys. And this pressure gets so high, it basically paralyzes the kidney's ability to filter waste out of the blood. That key job, glomerular filtration, it stops.
The kidneys stop filtering. Wow. Okay, so what's the immediate consequence of that shutdown?
It means a really rapid and severe buildup of metabolic waste in the bloodstream. Stuff like urea, creatinine, and things the kidneys are supposed to get rid of. That state is called uremia. Essentially, the body is being poisoned by its own waste.
Okay, so waste builds up, they feel awful, but the real killer, the guidance really stresses this, is specific electrolyte problems, right?
Absolutely. The number one most immediate life threat is severe hyperkalemia. That's dangerously high potassium levels in the blood. Potassium is vital for muscles, especially the heart muscle. Kidneys normally dump excess potassium. When they can't, potassium will just shoot up.
And high potassium, what does that do to the heart specifically?
It seriously disrupts the heart's electrical signals. It can cause fatal abnormal rhythms and also bradycardia, a really dangerously slow heart rate.
Yeah.
On top of that, the body's also battling severe metabolic acidosis. The blood gets too acidic, and that actually makes the high potassium effects even worse. The body just can't get rid of the potassium or the acid.
Wow. So it's way beyond just not being able to pee. It's a full system meltdown because the filters are blocked, leading to toxic waste and these chaotic electrolytes. What if the blockage isn't fixed fast? What happens then?
Well, if that obstruction drags on, even for just, say, 24 to 72 hours, it can cause permanent, irreversible damage to the kidneys themselves. All that back pressure makes the collecting parts of the kidney, the pelvis, and the ureters swell up. That's hydronephrosis and hydroureter. That damage can stick around.
And you mentioned bladder rupture. That sounds terrifying.
It's another huge risk, yeah. If the pressure gets too high, the bladder wall can just give way and tear. And that means urine spills right into the abdomen. That's called a uroabdomen. Now, you've got urine full of waste causing massive inflammation and infection inside the belly. That's another life or death emergency needing surgery right away.
Okay, that clearly explains the why it's so bad. Let's switch to the what. What's actually blocking the flow? What did the sources say about the common culprits?
It does depend a bit on where the blockage is, ureters versus urethra, but the overwhelming majority are urethral obstructions downstream,
Yeah.
especially in males.
Like our Fluffy and Buster examples. So down in the urethra, what's usually plugging things up?
For male dogs, the most common culprit is uroliths,
Hmm.
urinary stones. They often form up in the bladder, then travel down and bam, get stuck in that narrow urethra, usually struvite or calcium oxalate types. Cats can get stones too, but they're less likely to be the main obstructing thing compared
Oh,
to
yes, the infamous.
urethral plugs. Exactly. These are the number one cause of obstruction in male cats by far. And they're not hard stones usually. They're this sort of soft, Gungy mixture, often crystals like struvite again, mixed with mucus and inflammatory cells. Think of it like a sticky biological cork jamming up that tiny cat urethra.
And these plugs in cats, they're often linked to something else going on, aren't they?
Yes, very often. Strongly linked to feline lower urinary tract disease,
Yeah.
FLUTD, and specifically feline idiopathic cystitis, or FIC. That's basically inflammation of the bladder in cats, often without a clear infection.
Right.
And that inflammation itself produces the mucus and cells that help form the plug.
So inflammation, mucus, crystals, it all combines.
Okay.
What else can block the urethra besides stones and plugs?
Other things we see are strictures that scar tissue narrowing the tube, masses, tumors, specifically one called transitional cell carcinoma, TCC. It likes to grow near the bladder neck or in the urethra itself. In older male dogs that haven't been neutered, like maybe Buster, prostate problems are a big one. An enlarged prostate, maybe from benign hyperplasia or inflammation, can actually squeeze the urethra shut from the outside. Then there are less common things like blood clots, maybe trauma from like a pelvic fracture, or sometimes, rarely, it's a functional issue where the urethra muscle just doesn't relax properly. But that's usually diagnosed after ruling out everything else.
And you mentioned blockages can happen higher up, too.
Just briefly, yeah. Urethral obstructions blocking the tube between kidney and bladder, often caused by small stones lodging there. Actually more common in cats than dogs these days. Can also be strictures, tumors, clots, or very rarely if the surgeon accidentally ties one off during another surgery. And then blockages right at the exit of the bladder neck are usually big stones stuck there, or maybe tumors again.
That covers a lot of possibilities. Okay, so now, the really crucial part for owners, what does this look like? What are the signs you need to watch for?
Yes, this is where your awareness can literally save a life.
Yeah.
The absolute key takeaway, stressed everywhere, is this is an emergency. If you see these signs, you need to get to a vet immediately. No waiting.
What are those first things people might notice?
Often, the initial signs are just about urination itself. The single most common sign, and the one owners often mistake, is stranguria. That's intense straining to pee.
Yeah.
They're hunched over, pushing hard, and people often think, oh, they're constipated.
Right. I've heard that mistake happens a lot.
It does, and it's a critical mistake.
Yeah.
Straining like that is much more likely to be a urinary emergency, especially in male pet. That's a huge red flag.
Okay, vital distinction. Straining equals likely urinary problem. What else might you see early on?
Making lots of trips to the litter box, or squatting over and over outside, but only dribbling or producing nothing. That's polyuria. Maybe crying out or seeming painful when they try dysuria. You might actually see blood in the urine. That's hematuria. Or they might be licking their genital area excessively. Sometimes they start urinating in weird places too, outside the box or inside the house.
But some of those signs could just be like a regular bladder infection, right? Which isn't always a 5-alarm fire.
Yeah.
When does it clearly cross the line into life-threatening?
Exactly. The signs escalate when the obstruction becomes complete and those toxins and potassium start building up. Then you see the systemic signs developing. And this happens fast, often within, say, 24 to 48 hours of a complete blockage. These are the signs the body is really shutting down from the uremia and electrolyte chaos.
What are those really severe signs?
Okay, so you'll see lethargy, like real depression, profound weakness, loss of appetite, definitely. Vomiting is very common. You might notice signs of dehydration. Their belly might be really tense and painful because of that stretched bladder. They can actually become cold, hypothermic. And a really critical sign pointing to that severe hyperkalemia is bradycardia, that dangerously slow heart rate we mentioned. Eventually, they can just collapse. And the absolute definitive sign, if you could somehow know for sure, is anuria, zero urine production at all.
So straining plus any of those systemic signs, vomiting, weakness, definitely a slow heart rate, that's code red. Get to the vet now.
Absolutely. Do not wait. Time is everything here.
Okay, so the pet gets rushed in looking really unwell.
Yeah.
How do the vets figure out quickly, yes, this is a blockage, and how bad is it?
Speed is key for diagnosis and treatment. It always starts with getting a good history from you, the owner, asking about those signs, how quickly they came on, any past problems. Then a really careful physical exam.
And the absolute biggest clue on exam?
The single most critical finding, highlighted in all the guidance, is feeling the abdomen, feeling the bladder. The giveaway is a large, really firm, often painful, super distended bladder that the vet just cannot squeeze any urine out of, or maybe just a few drops with a lot of effort.
I imagine you have to be careful palpating that.
Oh, absolutely. Vets are very cautious. You don't want to press too hard and risk rupturing an already overstretched bladder. The exam also involves checking for those systemic signs: dehydration, slow heart rate,
Mm.
A rectal exam is important in male dogs to feel the prostate, and they'll look closely at the penis or urethral opening in males.
Okay, exam points strongly to obstruction. What are the immediate tests?
Emergency blood work,
Mhm.
STEP. It's absolutely vital to see what's happening internally, metabolically.
And what are you looking for specifically in that blood panel?
Electrolytes are top priority, specifically checking for that life-threatening hyperkalemia, the high potassium. They'll also check other things like sodium, often low, and phosphorus, usually high. BUN and creatinine, the kidney waste products, will be sky high, confirming that post-renal azotemia, the backup type. A blood gas analysis shows how bad the metabolic acidosis is. And they'll check a PCVTS, packed cell volume and total solids, to see how dehydrated they are, and maybe lactate levels, which can indicate poor blood flow to tissues.
And you mentioned the ECG before, linked to the potassium.
Yes, an electrocardiogram, an ECG, is essential if that blood work shows high potassium. It directly visualizes the effect the potassium is having on the heart's electrical function right now. Vets look for classic changes: tall peak to T waves, a longer PR interval, a wide QRS complex. P waves might shrink or disappear entirely. That's slow heart rate, bradycardia. And in the worst case, chaotic rhythms that could lead to cardiac arrest. Seeing those changes tells them they need to act immediately to protect the heart, like giving calcium gluconate.
Okay, blood work and ECG confirm the metabolic emergency. How do they pinpoint the actual blockage itself, where it is, what it is?
Right, so imaging and checking the urinary tract directly come next. A urinalysis and urine culture are usually done, but after they relieve the blockage, often from the urine collected via catheter, the urinalysis can show crystals, blood, inflammation. The culture checks for bacteria, which guides antibiotic choices later, though. It's important to remember most cat obstructions aren't initially caused by infection. And if they get stones out, sending those for analysis is really important for future prevention.
And imaging, x-rays, ultrasound.
Yep. Radiographs, X-rays, are good for seeing radio-opaque stones, the kind that show up white. Sometimes they need contrast studies. They inject dye to outline the bladder and urethra, which helps find stones that don't show up on plain X-rays, or things like strictures or masses.
Ultrasound sounds useful too.
Ultrasound is fantastic here. Highly recommended. Gives a great view of the bladder, confirms it's distended, checks the bladder wall thickness. Crucially, it lets them look at the kidneys and ureters for that dilation, the backup pressure signs. It can see both types of stones, radio-opaque and radiolucent. And it's really good for checking the prostate in male dogs like Buster.
So ultrasound gives a really good overall picture. What about CT?
CT scans are probably the most sensitive test for finding stones stuck way up in the ureters. It gives a really precise location and picture of what's going on, especially higher up.
And you mentioned trying to pass a catheter is also diagnostic.
Absolutely. The very act of trying to gently pass a urinary catheter tells the vet a lot. They can feel exactly where it stops, what the resistance feels like. Is it gritty, like a plug or stone, or is it a tight narrowing like a stricture? And of course, successfully passing it is the first major step in treatment too.
Makes total sense. Okay, so we've covered what it is, the dangers, the causes, the signs you need to see, and how vets diagnose it fast. Now for the critical treatment. Saving their life.
Yes, this is where the emergency action really happens. Two immediate priorities.
Okay.
Stabilize the patient metabolically and relieve that physical obstruction.
How do they stabilize a pet who might be crashing from the high potassium and waste products?
Okay, if the bladder is incredibly distended and the pet is really unstable, maybe shocky, the very first thing might be a decompressive cystocentesis. That's carefully putting a needle through the belly wall directly into the bladder to drain off some urine. It gives immediate, though temporary, pressure relief, helps kidney function a tiny bit, and makes the pet much safer to anesthetize or handle for the next steps.
Right, get some pressure off fast. Then what?
Aggressive DC fluids, intravenous crystalloid fluids, given quickly. These are vital. They combat dehydration and shock, improve blood flow to the kidneys, and importantly, they help dilute the toxins and actually help the body excrete potassium, lowering that dangerous level.
And for the really severe hyperkalemia, the specific drugs you mentioned.
Yes, if the ECG shows those dangerous changes from high potassium, specific emergency drugs are needed. Calcium gluconate is given IV first. Think of it like a temporary shield for the heart cells. It stabilizes the heart muscle membranes against the effects of potassium, preventing deadly arrhythmias. But crucially, it doesn't actually lower the potassium level itself. Its effect is fast, but doesn't last long.
Okay, so calcium protects the heart. What actually brings the potassium level down?
The most common and effective way to rapidly lower potassium is giving a combination of insulin and dextrose, also IV. Insulin drives potassium from the blood into the body's cells, effectively lowering the levels circulating around. Dextrose, which is just sugar water, is given at the same time to stop the insulin from making the blood sugar drop dangerously low. Sometimes sodium bicarbonate is used too, as correcting the acidosis can also help shift potassium into cells, but it's used a bit more cautiously.
And pain relief must be critical through all this.
Oh, absolutely. These animals are in significant pain from that stretched bladder, the inflammation, the procedures. Opioids are essential for effective pain management.
So, patients more stable, pain managed. Now the main event, relieving the actual blockage.
Exactly. The most common approach is urethral catheterization. This is usually done under heavy sedation or general anesthesia. The vet tries to gently pass a lubricated urinary catheter up the urethra. They might use sterile saline flushed through the catheter to try and dislodge a plug, or sometimes they can perform retropulsion on stones.
Retropulsion, that's flushing them back into the bladder. Why do that instead of pulling them out?
Yeah, it sounds counterintuitive, but the urethra is really narrow and delicate, easily damaged. Trying to drag a stone out through it can cause more harm. Flushing it back into the much larger bladder makes it easier and safer to deal with. Once the stones are in the bladder, they could be removed surgically later in a planned cystotomy when the patient is stable.
Okay, that makes sense. What if they just can't get the catheter passed, like the stone is too big, jammed in there, or maybe it's a stricture?
Right, if flushing or retropulsion doesn't work, or if it's something like a tumor or severe stricture blocking the way, or sometimes with ureteral stones that won't pass with medical management, then surgery becomes necessary.
What kind of surgery are we talking about?
Well, the most common surgery related to this is probably a cystotomy. That's surgically opening the bladder to remove stones, either stones that formed there initially or the ones that got flushed back from the urethra. If a stone is really truly stuck in the urethra and can't be moved, they might do a urethrotomy. That's making a small cut directly into the urethra, often in the scrotal region in male dogs where it's a bit wider, to physically take the stone out.
And what about those male cats, like Fluffy, who keep blocking over and over with plugs? Is there a surgical fix for them?
Yes, that's where the perineal urethrostomy, or PU surgery, comes in. It's often called a salvage procedure. It's typically reserved for male cats who have repeated obstructions despite medical management or who develop strictures making catheterization impossible. Basically, the surgery removes the narrowest part of the penis and urethra and creates a new, wider urinary opening, more like a female cat's anatomy. It's a permanent solution to prevent future blockages from plugs or small stones, although they can still get other urinary issues like infections or inflammation.
Wow, that sounds like a big deal, but definitely life-changing for those chronically affected cats. Okay, so the blockage is clear, one way or another. What happens immediately after?
Post-obstruction care is really intensive. Usually, an indwelling urinary catheter, one that stays in place, is left in for maybe 24 to 72 hours. This serves a few purposes. It allows the inflamed, traumatized urethra to rest and heal. It prevents immediate reblockage from swelling or spasms. And, really importantly, it lets the vet team accurately monitor urine output.
Why is tracking the exact amount of urine so critical right after unblocking them?
Because of something called post-obstructive diuresis, it's very common. Once the pressure is off, the kidneys, which were kind of stunned, often kick into high gear. They start producing huge volumes of very dilute urine as they flush out all the accumulated waste products. The pet can actually lose a massive amount of fluid and electrolytes this way. So they absolutely need to stay on IV fluids, sometimes at very high rates, just to keep up and avoid getting dehydrated all over again.
And continued blood work monitoring too, I assume.
Oh yeah, definitely. For several days usually. Checking electrolytes, especially potassium again, kidney values BUN and creatinine, and their acid-base status. The good news is the hyperkalemia usually resolves pretty quickly once urine starts flowing. The azotemia, the high kidney numbers, should start coming down within 12 to 24 hours, though it might take a few days to get back near normal.
What about medications during recovery or when they go home?
Pain meds are continued, of course. Often they'll go home on urethral relaxant medications, like prazosin, especially cats. These help relax the muscle spasms in the urethra that could contribute to reblocking. Antibiotics are only given if that urine culture actually confirms a bacterial infection. It's really important not to just give antibiotics routinely because a catheter was placed that just breeds resistance. And vets are usually cautious about using things like steroids or certain NSAIDs right after an obstruction due to potential kidney effects. And then Once the indwelling catheter comes out, usually after a day or two, they need really close monitoring, either in hospital or immediately at home for the next 12-24 hours, just to make absolutely sure they can urinate well on their own without straining again.
And then the focus shifts entirely to long-term prevention, right? Because you don't want this nightmare happening again.
Exactly. Long-term prevention is absolutely crucial, especially given how often this can recur, particularly in cats. And this strategy depends completely on what caused the blockage in the first place. If it was stones, they need analysis, then likely a lifelong prescription diet designed to prevent that specific stone type from forming again. Sometimes medications too. If it was a urethral plug in a cat like Fluffy, the focus is managing the underlying FLUKD or FIC. That usually means special diets again, often therapeutic urinary diets that help dilute the urine and manage crystal formation. Critically, increasing water intake is huge. And then a big one for cats is environmental enrichment and stress reduction. Stress is a major trigger for FIC flare-ups which lead to plugs. If it was prostate disease in Buster, then treating the prostate condition is key.
And owner education sounds like it must be a massive part of making that long-term plan work.
It's absolutely critical. Owners have to understand just how serious this condition is, why straining is never normal, the potential cost and intensity of the initial treatment, that very real risk of it happening again, and why sticking to those preventative measures, the diet, the water, the stress management, the follow-up vet visits, is non-negotiable. For really tough or recurrent cases, referral to a veterinary internal medicine specialist or surgeon is often the best bet.
Okay, so bringing it all together, what's the general outlook? If a pet goes through this, what's the prognosis?
Well, it really depends. Depends on the cause, how long they were blocked before treatment,
Yeah.
if there were major complications like kidney damage or a ruptured bladder,
Yeah.
and probably most importantly, how fast they got proper veterinary care.
What about for the most common scenario, the male cat with the plug?
With fast, aggressive treatment, getting them stable, getting them unblocked, the survival rate to actually leave the hospital is generally very good, often upwards of 90%. But, and this is the big, but the recurrence rate is high. Studies vary, but you see figures anywhere from like 11% up to over 40% chance of blocking again later in life, which just hammers home why that long-term prevention is so incredibly important.
And for dogs with stones?
For male dogs with urethral stones, the prognosis is usually excellent once they're unblocked and the stones are removed surgically, as long as they didn't have a really prolonged blockage that caused permanent kidney damage. Blockages higher up, like in the ureters, tend to carry a more guarded prognosis. They can be trickier to diagnose quickly, the treatment options are more complex, and there's probably a higher risk of lasting kidney damage.
And the long-term picture?
Long-term success really hinges on identifying and managing that underlying cause effectively. Whether it's diet, medications, stress reduction, treating prostate disease, whatever it takes to prevent it from happening again.
Okay, so let's just pause and reflect on everything we've covered here.
Yeah, we've really dived deep into this very serious issue of urinary obstruction. We've looked at how that simple blockage causes this whole metabolic chaos.
Yeah.
The specific culprits like stones and those nasty plugs, the critical signs that you as an owner might see, how vets race to diagnose and treat it, and just how vital that long-term prevention is.
And hopefully, this whole discussion has armed you with the understanding you need, knowing the urgency, recognizing those signs. It genuinely gives you the power to act fast and maybe save a beloved pet's life.
Which brings us to a final thought.
Yeah.
Given that really high recurrence rate, especially for male cats with plugs, and knowing how effective things like diet, water intake, and even managing stress can be, how does really understanding the biology behind it, that whole chain reaction of pressure, toxins, potassium chaos, change how we think about long-term care? It's not just unblocking a pipe, right? It's managing a complex predisposition. So what does that deep understanding mean for how you might approach preventing this awful event in the future?